Well, I always wanted to be the boss, and I guess I'll be Daryl DeWald today. Great. What a perfect day to have Zoom issues. I'm Kim Papich, Director of Communications. I have no Zoom in my office, but luckily I'm down the hall from Daryl, and he's putting on his mask quickly. All right, so let's get this started. We thought it would be timely to bring everybody back together today, so congratulations to everyone involved in pulling off what appears to be a seamless start to the semester despite our current circumstances. It's certainly not easy. Today we are going to answer some of your questions as well as alleviate any concerns as we navigate our new normal with virtual online classes and for many working remotely and not being physically present on campus. I think we'd be remiss if we didn't take a moment to acknowledge the things that are happening in Kenosha, Wisconsin after another unfortunate shooting and other social injustices that continue to take place and disruption in our nation. And we certainly feel what you're feeling out there. We know that you're tired. We know that you're frustrated, and we feel those things too. Hopefully we can all take solace in the great work that we're doing together and know that we can be there for each other. We have a full agenda today and a lot to share, so I want to get things moving, but I also want to remind you that there's a recording of today's town hall that'll be made available at spokane.wsu.edu/COVID. Also, thank you to those that submitted questions in advance. You're welcome to include your questions in the chat. We have several moderators that are working to answer your questions, and we'll also pose any that we can't answer in the chat. We'll give those to the panelists at the end if we have time. And for questions that are specific to college, keep an eye out for communications from those colleges. They continue to provide updates to their students and employees. So with that, I'm going to hand things over to Vice President and Chancellor Daryl DeWald. I'm going to go back to my office and see if I can get back on my own Zoom.
Well, here we are. And as Kim mentioned, in our new normal, we have some technical challenges occasionally. And you know what? I think it's been great. I've seen among many of you a willingness to be patient and as one colleague says, to be tender with each other in our new normal. It's great to see the number of folks who are joining us today. I will echo what Kim said in noting that I'm very proud of all the hard work and the patience that you're showing day in and day out. You are actively representing what we do here at WSU Health Sciences in a remarkable way. Our current conditions have not been easy, but I consistently hear and I see the determination of so many doing your best to keep our campus and our university safe, healthy, and running smoothly. I want to start with some positive updates across our campus. So I'm going to start with some research updates. In the just completed fiscal year, campus researchers brought in $37.6 million in grants and contract awards. That is a record high. Excitingly, between 2011 and 2020, external grant and contract awards for the campus almost quadrupled. If you consider what health sciences across the state, including nursing, pharmacy, and medicine, it's about $40 million in awards. You're to be congratulated for this great work. Researchers are using the funds to delve into many different types of human health with the intent of discovering new approaches to slow the onset and the progression of disease, to make healthcare more accessible, and to advance solutions that reduce our costs. And kudos to our researchers for pivoting quickly to address many areas of need specific to COVID. I want to take a minute to highlight a few areas that we are really having some success in. With the support from the Andy Hill Care Fund, 2 researchers are looking at the impact of COVID-19 pandemic on cancer patients in the state of Washington. I'll call out Ofer Amran, and he is using data from multi-care clinics to evaluate the impact of deferred or missed cancer preventative care during the state's lockdown. Another colleague, Patrick Johansson, is studying the impact of COVID-19 pandemic on the health and well-being of cancer patients living in rural and tribal communities. In other areas, researchers from several colleges across WSU have joined forces to form the COVID-19 Infant, Maternal, and Family Health Research Collaborative. The collaborative will conduct studies to address critical questions related to the impact of COVID-19 on the health of mothers, babies, and families. And as someone who recently became a grandfather, I really do appreciate this team's effort. Another area that we're just really excited about is represented by Sentinel Natison from the College of Pharmacy, who is working with Santanu Bose from VetMed on finding FDA-approved drugs to disrupt the pathways in which COVID-19 creates an exaggerated inflammatory response. And finally, faculty member Joshua Newmiller was appointed to the American Diabetes Association's COVID-19 Expert Advisor Panel. The new panel studies the impact the virus has on people living with diabetes. These are just a few examples of the many great things that are happening in our research enterprise. Thank you, folks. You're doing a great job. I would like to pivot now and talk a little bit about our capital updates and our improvements. For the few people who have been back on campus, you've seen some of this. So first, I'll start with the Eastern Washington University Center, the EWC or Phase 1 building. The building remodel, WSU Spokane finished its budget request to the state of Washington for funds to remodel the building. As academic programs and research activity swells, the project will upgrade the facility to open up more space on campus, support additional academic programming in the health sciences, and provide upgraded classrooms and student study spaces. We're also nearing completion on replacing the roof and preventing leaks during rain. I'd like to mention the Steve Gleason Institute for Neuroscience Regeneration. Recently, we started construction to remodel the Sprague Avenue building. After completing asbestos remediation, improvements started to remove and relocate walls. These improvements enable us to provide assistance to families dealing with neurodegenerative diseases in a family-friendly environment. In addition, many of you are aware, and especially our College of Nursing colleagues, we've had a relocation of the Yakima Nursing Program to the Pacific Northwest University campus. More room means expanded student space, a larger clinical practice area, and improved testing center. Location also allows WSU nursing students to interact directly with our pharmacy students who are already located on the campus, along with the PNW students in osteopathic medicine and physical therapy. Another thing that is certainly on the students' minds is a student recreation center. So improvements to the old bookie space within the CCRS building will transform the space into the new UFIT Recreation Center. The expanded space will feature new locker rooms, expanded cardiovascular and weight training equipment, and allows for future group classes. Demolition to the space has started, and following asbestos abatement, construction on the space will advance. And finally, the Central City bus line. Although not a WSU project, construction will be advancing in late September on the new Central City bus station that will be located along East Spokane Falls Boulevard, immediately adjacent to the PBS building. These improvements will greatly increase the campus access to mass transit within the Spokane community. So that's a little bit of an update on some of the capital projects, but we've had some really cool things happen in our leadership team. So I'm going to conclude with that good news. As many of you know, our campus welcomed 2 new important administrators, Mary Coythan and Mark Lee, who began their terms as deans of the College of Nursing and the College of Pharmacy and Pharmaceutical Sciences, respectively, July 1st. I have no doubt that Mary and Mark are going to do great things to advance the health sciences in their respective colleges and across the state. Mary and Mark, we welcome you aboard, and it's back to you, Kim.
Thank you. I think the universe is telling us that no one wants to see my face. So my camera is actually on right now and you can't see my face. So thanks, universe. It's my honor to queue up our new deans. I've had the distinct pleasure of meeting both of them. And let me tell you, if you haven't experienced the joy of being in their presence yet, you have something to look forward to. Both of these new deans are really salt of the earth and great additions to the Cougar family. So without further ado, let me pass it over to College of Nursing and Dean Mary Cortland.
Thank you, Kim. I anticipate that this year, like last, will be one we will remember for a very long time. Personally, I look forward to the challenges ahead, and as I visit with students and faculty, I know they are looking forward to this semester in spite of all the changes. In fact, faculty and staff have worked incredibly hard over the summer to develop primary as well as secondary plans that ensure that our students continue to receive world-class academic experiences that are hallmarks of WSU nursing. To briefly highlight how we will engage with our students this semester, our didactic courses will take place virtually. BSN skills labs and sims will be held face-to-face, but we have condensed that version with extensive protections in place in the forms of social distancing, restricted group sizes, and full PPE. Our DNP students will receive a lab-in-the-box kit for use during Zoom skills competency sessions. Certainly a lot of changes are occurring. Some of our COVID-inspired changes, such as telehealth education for DNP students and virtual open houses for student recruitment, will continue this academic year. The college will focus this year on improving diversity, equity, and inclusion across all programs and campuses. Several initiatives are also underway and include a listening session with students to identify gaps, needs, and opportunities, adoption and implementation of a holistic admissions program, and sponsorship of multiple activities for faculty and student education and professional development. These begin in September with our Cleveland Visiting Scholar presentation by G. Rume Alexander from the University of North Carolina School of Nursing. We're fortunate that Dr. Alexander will continue to provide consultation and workshops throughout the year, and we welcome you to these presentations. We're particularly proud to share some of our faculty accomplishments and honors in recent months. Renee Hopsel, Shelley Fritz, and Cowcub Shoshani are all going to be inducted in October as Fellows of the American Academy of Nursing, one of nursing's highest honors. Dr. Janessa Graves received the 2020 WSU President's Award for Leadership among faculty and staff. Debbie Brinker was just named a 2020 YWCA Woman of Achievement. Connie Wen-Trung and Deborah Etty authored tips on naming and addressing racism, culturally responsive communication for health science educators, which was accepted for publication in the Journal of Nurse Educator. Eka Berduli received a prestigious 5-year K Award from NIDA to focus on neonatal abstinence syndrome and training with a group of mentors. Dr. Tracy Klein was named to WSU's Faculty Status Committee, as well as to the Oregon Nurse Practitioner Hall of Fame. And we're particularly proud of Drs. Wilson and Fritz, whose work helps us to respond to our land grant mission to answer some of our state's most pressing concerns about COVID care. Their pilot study is a critical first step to identify alternative ways to ensure nursing's ability to provide ongoing care during this pandemic. Their work with mask fit testing will address and help to allay concerns about PPE shortages that have been experienced by the Western region's critical access rural facilities. Finally, I'd like to share some news about our degree programs and some of the progress we've made over the past year. As Dr. DeWald has talked about, our Yakima faculty and staff worked many hours readying and preparing for their move to the PNWU campus. We're disappointed we can't show off that campus to the community, but we're hoping to do so in the near future. Our Doctor of Nursing Practice program was named among the top 25 in the nation in the latest U.S. News and World Report rankings. And we continue to experience growth in both practice and research scholarship, receiving public and private funds totaling $7.93 million in 2019. This has placed the college as number 23 among nursing schools nationwide in the amount of funding received from the National Institutes of Health. This means that we are up from number 27 in 2018. Therefore, it's certainly an exciting time to be part of the WSU School of Nursing or College of Nursing, and I look forward to our adventures together. I have much to learn about all of you, and I hope you will join me in envisioning the future that is full of growth and opportunity. Back to you, Kim.
Okay, we're getting closer. Now you can see my face, just my background is backward. Next time you see me with the background, I've been Daryl. This is amazing. This is like a fun game. It's really fun. Okay, so I am now going to send things over to Dean Lead to fill us in on the College of Pharmacy and Pharmaceutical Sciences. Take it over, Mark.
Thank you, Kim. The College of Pharmacy and Pharmaceutical Sciences continues to educate leaders in pharmacy and expand the role of the pharmacists in healthcare teams, as well as fulfill our land grant mission by improving the health and wellness of underserved and rural populations. We will continue our legacy of providing transformative experiences for our students so that they can excel in their careers and take advantage of exceptional professional opportunities now and in the future. I'd like to go over some accomplishments next of the college over the past year and acknowledge that this past year has been full of hardships related to the pandemic, a public health crisis that none of us have ever experienced, and the great strife and division currently in the country. Nonetheless, the college continues to make strides in our profession, the community, the state, and the region. I'll start with our pharmacy students, accomplishments of our pharmacy students. Our students and faculty preceptors are serving on the front lines of the pandemic through their involvement with various COVID-19 testing programs in the community. For example, many students have worked in drive-through testing sites in Yakima and Spokane and on the west side of the state. Roughly 24 of our students are currently working with Walgreens on a drive-through test site in the Spokane area. It's obviously the darkest of times that our students shine most brightly, and I could not be more proud of them. On the faculty side, our faculty have brought in over $10 million in external grant and contract funding in the fiscal year that just completed in June. And this is a new milestone for the college. We expect to continue with this upward trajectory by expanding the scope of our research programs into the areas of nanotechnology, neuroscience, cancer biology, and drug delivery. Consistent with this expansion, our PhD program has been renamed, and it is currently known as the Graduate Program in Pharmaceutical Sciences and Molecular Medicine. Our college continues to evolve, and I'm so proud of the faculty, staff, preceptors, and alumni who support us as we progress and evolve. I also applaud our faculty, staff, and network of preceptors for putting in countless hours to solve several logistical challenges that our students have faced so that they can be practice ready when a COVID-19 vaccine comes to market. Several of our faculty members have managed to figure out how to get our students certified to vaccinate in time for the upcoming flu season, which is of particularly great significance this year. Our experiential team and faculty members have also been shuffling students around due to site closures. And despite difficulties, we continue to maintain high standards to ensure our students get quality experiences that will help them as they progress in their careers. Although I'm certain that our experiential team felt a bit like they were playing whack-a-mole at times over the past 6 months. Our student services team, student ambassadors, and marketing and communications team came together to create a festive and virtual white coat ceremony last week. While we weren't able to celebrate with our students in person, Seeing them put on their white coats for the first time made everyone in the college proud to present our class of 2024 student pharmacists. To be honest, I was pretty skeptical of this virtual white coat ceremony in the beginning, but our folks pulled this off exceptionally well, and we learned something about ourselves and our abilities in the process. Now, we've just recently launched 2 new programs I want to tell you about, and those are new PharmD dual degree and certificate programs with engineering and communications. Now, our students can receive their PharmD degree and specialize in a specific field such as business, engineering, strategic communications, or pharmaceutical sciences. I want to close by sharing with you an exciting new program that we've developed that will improve both student pharmacists' experiences and our communication to our alumni base. We are so fortunate to have an incredible network of alums both inside and outside the college. Many of these alums have recommended promising students to our PharmD program over the years, but it's always been a bit of a hit or miss process. To formalize and incentivize these efforts, we started a referral program called Refer a Future Cougar PharmD. I extend this offer to all of our listeners today. If any of you know someone who may be interested in pharmacy, you can refer them to us via our website or contact me directly. Not only will you receive very smart looking swag from the college once your referral enrolls in our program, you will have my profound gratitude, and I will do my best to ensure that you forever enjoy eternal peace and great happiness. With that, I pass the microphone back over to you, Kim.
And this just in, my background doesn't look backward to you. It only looks backward to me. So the hits keep on coming. Awesome. All right. So thanks for those updates, Mark. We have another dean to hear from today, and that's founding dean of the College of Medicine, Dean Tom Koviak. I'm going to toss things over to you, John.
Well, thank you so much, Kim. And Mark, boy, you promised a lot there at the end, so I'm not going to be able to beat that for sure. But I can give an amazing update on all the activities of the faculty, staff, and students of the Elson S. Floyd College of Medicine, because even though COVID is upon us, it hasn't slowed any of those groups down in doing amazing things for the college and for the people across the state of Washington. I first want to talk a little bit about our learn in place model. Our students and faculty and team have adapted as well as could be expected to this model. And we really appreciate everyone's patience and willingness to keep everyone safe in all of these activities. So thank you for that. When appropriate, we are having our students, whether they be in the medicine program, our nutrition, exercise, physiology, or speech and hearing sciences, we do have a few face-to-face interactions when there's no other way we can do things. When we are going to do those are always going to be done with appropriate measures in place to ensure everyone's safety. But for the most part, like the College of Nursing and Pharmacy, our programs are in virtual learn-in-place mode. Our research enterprise, though it has been slowed down in terms of the actual engagement in researchers, our researchers are not slowed down at all. They have been the most productive they have ever been. And we have had an amazing year in terms of total number of dollars brought in, our best ever. We have climbed up the rankings in terms of the Blue Ridge group to another 8 spots. And for a new medical school, that's amazing. So I want to thank all of our researchers for the work they are doing. As Vice President DeWald pointed out, we have some researchers in the College of Medicine who are very active in the COVID arena. They are not only advising local healthcare organizations, but advising people at the state level and in some cases across other regions of the country. And it is really amazing to have that kind of expertise, not only in the College of Medicine, but across pharmacy and nursing to advise not only us, but other people, and be a trusted place for information. So thank you for doing that. We have not slowed down either, just like the College of Nursing. We have some new programs in development, and one is starting this semester. It's a certificate of medical ethics. We were expecting maybe just 3 or 4 students in that program. We are currently enrolled at 17 or 18, and we are very excited about that. It's just the beginning for that certificate and what we hope to come in the future. We continue to unravel the idea of building a master's in healthcare leadership, and we are working on that. And of course, we already have that certificate of healthcare leadership in place already. We are doing some amazing things with Bobby Health, also known as Range Health. That's a collaborative between nursing and pharmacy to bring interprofessional practice opportunities to our colleges and to benefit the patients in and around our communities. Right now, we are doing COVID testing out in Airway Heights. We also have a program that administers to homeless in and around Spokane, making sure not only they can be tested for COVID and appropriately treated, but also if they have other conditions, we help out there as well. And then we have a very unique COVID monitoring program where we monitor patients who have been diagnosed with COVID, but don't need to be hospitalized, but do need to be closely followed, and we are engaged in that. So lots of amazing things that team is doing to help directly improve our communities in terms of COVID. I also want to talk about some of these firsts that our colleges is experiencing as we're finishing our journey towards final accreditation. We did have our first ever virtual white coating drive-through ceremony and a white coating evening event, and it went great, and that's due to an amazing team within the college and the health sciences to help pull all of that together. So I want to thank everyone who was involved in that for making that event a very special thing for our incoming students. I did mention accreditation that is coming up upon us very soon. I have an accreditation clock that's, it used to be in my office. It's right here at home now. And the numbers on the clock are numbers I don't hardly believe. That visit is coming up in October 25th. It's just a couple months away now. And our team is doing the last minute preparations. We did submit over 2,400 pages of documentation to the accreditors, and the team is really running on all cylinders right now. And that visit will be happening virtually at the end of October. And the last really good piece of good news that's going on is we are looking forward to hopefully having our first accredited residency program in Everett. That will be an internal medicine program. And in September, we have sort of the final visit with regards to that. And if all things go well, we'll be getting information out to our 4th year medical students. So this will become an opportunity for them to continue their training with WSU and the college. And stay tuned to this particular space in terms of GME, because I think there will be other announcements in the upcoming months about other opportunities for our medical students to train within the WSU system when they graduate. So very exciting. Kim and rest of my colleagues, I could go on and on, but I know I don't have the time. So really appreciate this opportunity to keep everyone informed. Back to you, Kim.
Thanks, Dean T. Those are really important updates. We want to cover some items with all of you that we hope will better inform you as it relates to our eventual return to campus. As a reminder, we're still in phase 2 in Spokane, and through phases 2 and 3, we're working remotely, and that remains the preferred option. Buildings are currently locked and only accessible by ID card. Do not report to work unless directed to do so by your supervisor. Some essential staff are currently on site, as well as some faculty and staff who have been granted an exception. Some researchers are also back, yet note that specific criteria exist for those working in laboratory environments. Upon your return to campus, your department may consider additional social distancing strategies. We did have some questions pre-submitted about individuals who are working in areas with cubicles or areas that can't be separated by plexiglass. Those are conversations that'll happen with your supervisor, and that's where we really start getting into alternative days or shifts or staggered reporting and departing. So you'll be given ample notice before you come back to campus, and your supervisor will work with you on plans to make sure that you're safe. Employees returning to work must complete online training and conduct symptom self-attestation every day. If an employee is feeling sick with fever, cough, or respiratory symptoms, they should stay home and contact their healthcare provider. For face covering, our face coverings must be worn by all employees. If you do not have a face covering, we do have a lot that are available to give to employees who need them. Social distancing is definitely at play right now, including only one person in an elevator at a time. Commonly used surfaces are being wiped down frequently. We've got custodial and facility staff that are doing an amazing job to make sure that commonly used areas and surfaces are sanitized once in the morning and once in the evening. And then when you do come to campus, you'll notice that there are cleaning stations that are available throughout for student, staff, and faculty to do some of their own sanitization as well. A topic that we have received lots of questions on, how we do our notification and identification of positive cases and how contact tracing works. I'll start with students. So if a student tests positive for COVID, and this means that they've actually had a positive test result from a healthcare provider or laboratory, they are to follow the directions given to them by public health officials. It's optional to notify their department. However, the student does need to follow their department's protocol for missing any classes due to illness. And as well, they need to follow any of their clinical placements and any healthcare provider guidelines for if they are positive and they're in a clinical setting. Colleges and departments are also doing a great job providing any additional college level information to students. Daryl, right there, I'm going to pause and I'm going to interject one of the pre-submitted questions. It's specific to our students' need for many of them to receive COVID testing. We know that's a need system-wide, but we're also hearing from healthcare providers that they need our health profession students to get testing before they come into clinical environments. What can you tell us about availability of testing for students?
So Kim, it's a great question. And first I want to confirm that we have heard from our healthcare partners and by proxy our faculty, staff, and students how important testing is. So as a system, we feel it's vitally important too. And like our partners, we want to keep our students safe while protecting the patients and the staff. I would mention that I'm co-leading an effort at WSU to get student testing up and running. And I want to ensure that we're close to rolling out communications about how we will do the testing and when and where you can go to get the testing done. There are multiple layers to this and a few remaining loose ends, but I promise we're close. Earlier today, I was working with leadership on campus about the way that we would accomplish this, and then working with our central leadership regarding how we communicate this out. So please be patient with us. We know that this is affecting you, and we are trying to put a testing program in place.
Great, that's great information, Daryl, thanks. All right, so let's jump back into contact tracing and notification. If a staff or faculty member tests positive for COVID, same deal, they should follow directions given to them by public health. It's optional to notify their direct supervisor or to contact HRS Disability Services. However, the employee does need to follow their department's protocol for use of sick leave. So we've seen a common misconception that employees feel like they have to self-report. They do not. It's optional for them to report. Also, if there is a confirmed case on campus of an individual with COVID, there is a good likelihood that we are not going to announce that to our campus community and that you are not going to hear about that positive case. The only way that you would hear about a positive case is if you were potentially exposed and public health officials or contact tracers were in contact with you about potentially being exposed. If an employee optionally discloses that positive result, we have a process by which you, reporting it to a respective dean or the chancellor, who will notify the campus incident command system. We're making sure that we keep names of individuals confidential. Also, an additional moment of empathy. We know the burden and hardship that COVID presents to working families with school-aged children, especially our female staff and researchers who are wearing many hats. Ultimately, this comes down to a conversation with your supervisor regarding your leave and work options. And we know that you're going to have to accommodate your children's schedule for the foreseeable futures. Some of those options could include a flexible schedule or temporary schedule adjustment. If an employee is unable to work or telework as a result of needing to provide care, they may be eligible for certain leave provisions. The best place to look for information about this is on WSU's COVID site, so wsu.edu/COVID-19. Back to that positive test result, we will work with local public health to ensure that there's nothing else that we need to do as a campus, including any deep cleaning or sanitization. In the event that that we are doing that deep cleaning, that area will be closed to faculty, staff, and students. And so just be aware of that. Again, you will not hear about a positive test result unless you were potentially exposed. Finally, specific to COVID and our return to campus, we want to remind people there is emotional support and help available for students and staff. More information is available both on the systems website and our website at spokane.wsu.edu/COVID. And that concludes our COVID information. And checking the time, I think we've got sufficient time to answer some of your pre-submitted questions. So I will start off with you, Daryl, and a question that was submitted. Is there anything you can share with us specific to spending and or hiring slowdowns?
Sure, Kim, and I will try to give a little bit of context. So WSU for several years was working very hard to correct some deficit spending, and leaders like Dean Tom Koviak and now onboarding excellent leaders like Dean Coithen and Dean Lead, they really worked hard to limit their expenditures and to increase their revenues. So we were in a pretty good place. We finally had a non-deficit year this year, but then COVID came along. So as many of you know, we were asked to all go through a 10% reduction exercise, which approximates the reduction in the state allocation to Washington State University. And that has had a number of effects, but first, how it's affected us is we've all had to do an extra budget exercise. We've had to predict ways that we can reduce our spending and increase our revenues. And I want to say thank you to everybody who really leaned into that and did a great job. And what we've tried to do is to protect positions and protect colleagues. And what I would tell people, Kim, is that there aren't currently plans for furloughs or large-scale salary reductions. And we're hoping to stay the course on that. But what has happened is there's been a more restrictive process by which we hire people into the colleges and on campus. And that requires a rationale and justification that folks are serving in essential roles, where there would be harm to the academic units or to the campus if we didn't bring those people back on board. So what I want to say is we're still in process with this. By the end of September, we are all being asked to submit our final budget templates for the coming year. And so, Kim, I want to, again, just make it very clear, I appreciate the hard work. I think we've done an outstanding job in the health sciences, and the fact that we have these great programs that are largely growing in this environment is nothing short of amazing.
Great, thanks, Daryl. We know we received several questions about that. And then the other top contender on faculty and staff's mind, and probably on students, another one best suited for you to answer, Daryl, when will decisions about spring 2021 be made?
Yeah, and Kim, I'm glad to make an attempt at this. What we are trying to do is make decisions as an institution earlier, so that we would be making decisions in August, September, and October for the spring of 21. We're trying to front load those decisions as much as possible. We do have to rely on inputs from the state level and the county in some cases in terms of the way that we make those decisions. As you know, we have campuses that are largely in phase 2, but Pullman is in phase 3. So we're in different places, and how we coordinate to make those decisions is pretty complicated, but we're making every effort to communicate the decisions we're making in September.
Great. And the team is indicating that we've got a pretty quiet chat out there. Again, if, as faculty and staff, if you have any additional questions that we haven't answered for you yet, please include those in the chat. I have another pre-submitted one that I can answer. The question is, what support is going to be given to employees who are continuing to be required to use personal equipment to work from home, such as personal internet and cell phones? We had a chance to check in with HR about this one, and Laura Hamilton shared that if an employee does not have reliable internet access, there's several options, including working with the department to figure out if there's a way to safely come to campus to work with reliable internet. Use of a departmental hotspot. There are some hotspots available for faculty and staff. Or we still have that drive-in Wi-Fi option where IT was cool enough to extend our Wi-Fi from the building out into the parking lot. Again, employees should work with their supervisor to engage in conversations about available options. As far as office equipment that's being used at home, such as docking stations, monitors, office chairs, Laura also shared with us that departments are able to put into place a sign-out process for university equipment that you can take home. This should be done through an informal telework agreement to ensure an appropriate accounting. This sounds exactly like Laura Hamilton, by the way. This should be done through an informal telework agreement to ensure an appropriate accounting and inventory of equipment is kept and ensure employees understand the processes if equipment is lost or broken. Okay, let me check one more time to make sure that nothing came in off the chat. Doesn't look like that, so we're gonna save some time for you all. I want to respect your time. I will go ahead and end things with some final thoughts from Daryl.
Well, thank you, Kim. And what I want to do is to thank Dean Tomkowiak and this amazing team in medicine, Dean Koithen. Your team is just incredible. And then Dean Lead, way to go. All colleges getting stronger and doing better in this crisis time is just, it really stretches your mind even to understand how that's happening. But I know how it's happening. Great leadership, those who really care, and those who are committed to serving others in society in the best way that they can. So it's been great to hear from you today, and thanks for joining us. It's inspiring to hear the positive stories. I even learned some things today, and Mark, I'm glad you're guaranteeing all those things. I might get into that too, but the positive stories that have been shared today are really just the tip of the iceberg. And I want to reiterate, please take care of yourselves, your families. We're going to get through this. And it is in times like this, it is important, more important than ever probably, that you remember why you chose a profession in healthcare and you look for the opportunity to be a positive force in your community. So I would just say thank you.
Awesome, great words to end with, Daryl. A couple housekeeping reminders on September 1st. It's the Provost virtual introductions, look in campus announcements for the different Zoom links for faculty, staff, and students. And then also on September 10th and September 11th, we'll have our President's Town Halls with President Schultz, and the Provost will join him for those. So that's also available in announcements. Otherwise, thank you to all of you who joined us today. A recorded version of this town hall and a list of the questions with answers will be available on our COVID-19 page at spokane.wsu.edu/COVID. Otherwise, I'm headed to the bar. Take care.